What's up everyone? So in this video, you are going to find out if I am pregnant or not, which I don't even know yet because my transfer is in 2 days. I'm filming this right now because I wanted to go over some of the things that I had to do in order to prepare for the transfer. So that way, if you are currently doing an IVF cycle or you are preparing for a cycle in the future and you're not really sure like what that looks like, I will explain my protocol and what I am doing in order to get to that transfer. Now, I have already previously done my egg retrieval and I actually have a video about that, what happened, how it went, all of my results, and I will link that above here. So if you haven't done your egg retrieval, I would start there first and then come on over to this video since this is part 2 of my IVF cycle. So my egg retrieval was actually back in February and this is currently May. And after my egg retrieval, they wait for your period to show up and you have to call the clinic after that happens. I believe it took about a week for my period to show up after I had my retrieval. And so once I started my period, they actually put me on birth control after that. So I think on day 3 of my cycle was when they started me on birth control. Now, I was only supposed to be taking active birth control pills for 2 weeks, but I ended up having to take them for about 4 weeks because I did get COVID right at the end of my 2 weeks and I had to notify my IVF clinic and they just kind of paused everything. So they just had me stay on active birth control until I was done with my 2 weeks of COVID. So after I was done and I finished my 4 weeks of birth control, then they had me start taking lupron shots. So these were 1 shot that went into your belly, almost just like the meds that you take for egg retrieval, but it was only 1 shot a day. We were doing it in the morning and they were not hard. They're pretty easy, pretty small needles. And I did that for about 2 weeks. Between the birth control and the lupron, what they're doing is kind of putting you in a state of menopause. So they're shutting down your system. So that way you stop like ovulating and having a full cycle because they want to get your hormone levels down and they want to start creating an environment where your lining is thick and it's ready for the transfer. So they gave me a schedule and they had me start the lupron shots, and about a week after doing the lupron, they told me when to stop my birth control. So I was doing the lupron shots and the birth control at the same time. And then once they took me off of the birth control, they said, okay, now you're probably gonna get your period in a few days. Go ahead and call us when that happens. So I think it only took me maybe like 3 or 4 days in order for my period to show up after stopping the active birth control. And that's when they brought me in for an internal ultrasound and some blood work just to make sure that like everything in my cycle was just quiet, like everything was quiet. After that, they started me on estradiol pills. So I started with 1, taking it in the morning, the afternoon, and the evening. And then they gave me a schedule on when to up the dose. So then I was taking 2 in the morning, the afternoon, and the evening. And I was doing lupron shots throughout this whole entire thing. I actually had to do a lupron shot by myself. It was the first shot that I ever had to do because Alvin had to go to work very early that day. He had a very early meeting and you have to take these medications at the same time every single day. So I actually have footage of that because it ended up being like a lot more emotional and just kind of like hard in my mindset to do because previously I'm just kind of, you know, standing here waiting, like I don't even look, like I wait for Alvin to just stick me and you don't really feel anything. But having to do it yourself, like take the needle and physically put it into your stomach and you have to look, like that was definitely hard. So I'll go ahead and insert that footage here just so you can see if you're having to do it yourself, like it can be mentally challenging. So today is Monday and last night Alvin and I were talking and he had to be at work really early, well, like at 7:30, which is earlier than what he normally goes in. He normally goes in around 9, and unfortunately it was for like something very important, like he had to be there and it's not like he could like really come home. But the problem with that is that we are currently giving my IVF injections at like 9 a.m. or around 9 a.m. And so unfortunately today I have to give myself my first injection yeah, I mean, thankfully I'm only at 1 shot a day because I'm getting ready for my transfer in a few weeks. Still, like, I have not had to actually give myself any. Alvin has been doing all of them, like, in the last few months, even when I had like 2 or 3 a day. I've been trying to put it off for as long as I can, but I have to do it now. Well, I put all my supplies here right now, but if my supplies weren't here, I have a little like baby area. So I have our 6 frozen embryo numbers here. We bought this little whale as like a cute little first baby animal, and then this was the first book that we bought because I used to read this one to my brothers, so I really like that one. And then I have our little baby Wheeler onesie here. So yeah, this is like, I walk past it every day because this is in our bedroom, obviously, and it just makes me happy. I think we did the right side the other day, so we have to do the left side. And I forgot to put the ice back on, so hold on a second. Let me just, usually I ice it and then I wipe it off right beforehand. Okay, I have to do it at, like, Alvin said 45 degrees. And he said I should like get it close and then like look away and then like put it in. I need like someone to be like, all right, 3, 2, 1, go. Oh my gosh. It's just so hard. Okay, I'm gonna do it. Okay, I'm sorry, I don't know why I'm crying, but I did it. Hopefully yeah, I got it all out. Anyway, I just hope my blood test goes well today. I think because I was like worried about doing this today, like last night I was having nightmares about, like, I went in and I got transfers done and like they kept not working, and I used up like 3 of my 6 embryos, and I was like getting really upset that like I still hadn't had a pregnancy yet, and I was like halfway through like what I had. So I think it's just because like I am getting closer to the transfer that I'm just like, I was being like super positive about it, and now it's like getting a little hard to not doubt or like not doubt it, but like not worry about like what is happening in the future. But we did it. We did our shot and that is done and over with. Oh yeah, and like these are like where you put them, and this is just from me getting ready from the transfer. I have a whole one that's filled up from my retrieval. So initially when you went in for that blood labs and the internal ultrasound for them to make sure that everything was quiet, that is when they will call you and let you know that you can have a tentative scheduled frozen embryo transfer date. So they had told me that I would be able to do May 5th or later than that, and I obviously picked the earliest date possible, so May 5th is what I picked. And then at that time they sent in the orders for your progesterone and oil to come in the mail, and then you will start taking those about a week before your actual frozen transfer. So last week they brought me in for an appointment. It was about 9 days before my actual transfer is going to be scheduled, and they did another blood test and another ultrasound just to make sure that my lining was thick enough in order to keep on with doing the transfer. And that is when they gave me the instructions on how to do the progesterone and oil, and you had to do progesterone suppositories. So let me just tell you that the progesterone shots are definitely the scariest ones. They are the ones that go kind of on your like love handle, like upper butt cheek area, and this is the size that you draw up the oil with. This is what the oil looks like. So it's actually pretty like thick, and a lot of people say to warm it up because it's really hard to like push it in. But once you draw up with this needle, you actually change it to this smaller needle, but when I say smaller, it's a lot larger than the other needles I've been using. This is what you are injecting into your buttocks. So yeah, that is a pretty big needle in my opinion anyway. The first day that we did it was really scary for me. Like I had anxiety like all night long because I'd wake up and do this at like 8 o'clock in the morning, and you do it once a day. And so I did do like the freezer pack on my right cheek is what I started on. But you're kind of doing it like kind of up here in this area, not like actually on your butt cheek. But you have to like make sure there's no blood and like just do, there's a lot more instructions for these than when you just do like the stomach shot. And so these ones were definitely more scary in my opinion, but I'm already on day 4 or 5 of doing these, I think. So it's actually gotten easier. But the thing is, with the progesterone in oil, you actually will be doing them all the way up till 10 weeks of pregnancy if you end up being pregnant from your frozen embryo transfer. So I need to get used to these because I'm gonna be doing them for like 13 weeks total. So currently right now, I am 2 days away from getting my transfer, like I said. And so I am taking my progesterone shot in the morning, and then I still take 3 of these estradiol tablets. Sorry, I have a Band-Aid on, but they're pretty small. They're like really easy to swallow. And so I take 1 in the morning, 1 in the afternoon, and 1 in the evening. And then the other thing that I'm taking, there are progesterone vaginal suppositories. So this is what I am taking, and it's like a tablet. And it comes with these like applicators. So you literally like take the tablet out and you put it in the applicator, and then you have to insert it and pop it in there. I have to do 4 of these every evening at bedtime, and I like lay in my bed in order to like get them in there, but definitely use like panty liners the next day because they are so messy. It doesn't seem like they would be messy because this is like, as my friend said, I'm like a Pez dispenser. They're like a big like chalky tablet, and I didn't have any problem like putting them in, but definitely the next day everything is just oozing out, and yeah, it's very messy, not the best fun. But yeah, I do 4 of these every evening. That's my protocol right now, but I will update you guys again on Thursday when I actually go to my transfer. I'm not exactly sure the directions for all of that, so I will give you my experience after I have the transfer done. And then I think I decided that I'm not going to test early. You can actually start testing like 5 days after transfer using just regular like at-home pregnancy tests, but I think I'm going to totally wait for my beta blood test, which should be about 9 to 10 days after transfer. And so I'm going to try and like get the footage of when they call us and let us know if we're pregnant or not pregnant. So hoping, cause like this is my birthday month. My birthday is on May 24th, and by May 15th, I should know if I'm pregnant or not pregnant. Okay, currently driving to my transfer. We have 22 minutes left before we get there, and it's 10:30 in the morning. So I was told to take my Valium. I have to take 3 of them, and let's hope I can function once they kick in. All finished with my procedure that went out like really quickly, and Alvin was able to like be in the room. And then I had made this sign. I don't think I showed you guys, but we took some pictures with it, so I can pop those up for you guys to see. But then they also gave me a picture of our embryo. So that is what is currently inside my uterus at the moment, which is crazy to think about. And then they also gave us a little card here. Happy transfer day. I can save all this stuff like in my bullet journal. I'll probably like paste it in there as like a thing. Happy transfer day from the Virginia Fertility IVF team. Look at all the sperms and eggs. Oh my gosh, that's so cute. Yes. So I did get my discharge instructions, and it's pretty much easy peasy. I don't have to like care too much. I don't have to be on like bed rest or anything, but I do have to keep doing all of my shots. Literally everything is like everything literally
everything's the same.
Yeah, everything's the same. Sorry, the volumes are just still, I guess, there. But yeah, super excited. So we're probably going to just have like a nice date day, go get like sushi, some boba tea, and then, oh, I go back May 16th for my beta blood test, and then that's when we actually find out if we're pregnant or not. So technically I'm pregnant until proven otherwise, so you can't have like caffeine, alcohol, like all that kind of stuff, but I'm excited. May 16th. That's a little bit further away than I thought, but that's because they couldn't do it on the weekend. So Monday, in a few weeks, we're gonna find out, yes.
They were in high school when they met, and things got kinda awkward. With sparks in the air, he would stare at her in class, and she would try to act cool. But it was obvious, like, ooh, they would be together.
Alright, we stopped and we got boba tea from this place called Kung Fu Tea. I got the honey one. You got, oh, you already stuck yours in, so I do
It's pretty easy, yeah.
This, and I just do this.
Yep.
Oh. Whoa, mine's a sweet. Is yours sweet?
Super sweet.
The boba's good. I actually saw on the step menu, you could actually ask for like a percentage of sweetness, but I didn't know that.
Yeah.
This one's good. You want to try mine? Does yours taste the same?
Tastes like mine, but with honey.
Oh, yeah. I like the honey one a lot. That one's good. I wish I could make this at home.
Man.
That's good. Okay, so I just got back from getting my blood test done for my beta today, and I am very, very, very nervous. You know, I want it to be positive, but I am very worried that it won't be positive. There's just so many different factors, and like I've looked into a lot of things like in the IVF group that I'm in on Facebook, like there's such thing as like chemical pregnancies if like your HCG just isn't high enough, and so there's just like so many things that can go wrong, so I'm hoping that it won't go wrong. They're supposed to call me, and when they call me, I will probably do like a 3-way call with Alvin because he's at work today, and I asked them if they would leave a voicemail, and they said no, they would probably just ask me to like call them back. So we're probably gonna do a 3-way call. But I had bought this gift for Alvin like over a year ago, and I'm wrapping it because if we're pregnant, I'm gonna give it to him. I don't know why I'm getting emotional. This is the medication, I'm sorry. Anyway, so he loves The Office, and I got him this Little People, The Office. So there's Pam, Michael, Jim, and Dwight, and like I love the little coffee cup. It says, you know, world's best boss, and then Jim's thing says Jim, you know, heart Pam. So I think Alvin is going to love this because of him just loving The Office so, so much. So I'm gonna wrap it so that way if it is good news, I'm gonna give it to him to unwrap because he doesn't know I have it. So this is like our pregnancy, you know how there's like, what is it called? Like push presents or whatever for when you push the baby out? Well, this is Alvin's you're gonna be a dad present. So unfortunately I only have like, flower-ish paper. So it's all wrapped up. I'm gonna wait for the call, and then I'm hoping to film the call. Okay, can you hear both of us?
Yes. All right, guys. So today's beta HCG level was 5.86. Okay, anything greater than 5 indicates a positive pregnancy. So obviously this isn't as high as I would like to see it, but we're not going to stop our hormones just yet, okay? So what we're going to have you do, Jackie, is continue taking your hormones just like you've been doing. We're going to repeat the beta HCG level on Wednesday, just like we planned, but then as long as it's rising on Wednesday, we repeat it again on Friday. So whenever the beta-HCG level starts out low but still positive, we repeat it twice versus the one, okay?
Okay, and you said it was a 5.8?
5.86. So do not stop your hormones yet, okay?
Okay. Hi.
All right, I guess that's good.
No, that's really bad.
But it's above a 5.
Yeah, but all of my research, like, it's probably just going to turn into what is considered a chemical pregnancy, because like 5 is like the lowest it could go. It should be in like the 100s.
Oh, like as in 100?
Yeah, at least. From what I've like looked up with like chemical pregnancies and stuff, it's just that like it could have just implanted wrong, or like the embryo could have just been like abnormal. But I've seen a lot of people like posting in the group that even like got their embryos tested, that like it still ended up like chemicals. Hello?
Hey, Jacqueline, it's Carrie from Virginia Fertility. How are you?
Good, how are you?
Good. Got a second to talk about today's lab results?
Yeah.
All right, Jacqueline. So unfortunately, today's beta-HCG level has dropped to negative, which would indicate that the pregnancy did not progress. So we would have you stop your hormones at this point. We have our IVF meeting tomorrow afternoon, and then one of us will be in touch with you after that, okay?
Okay, so then you guys are calling me after. I don't have to be at that meeting is what you're saying?
No, ma'am. No, ma'am. We call you. When I say we, it's either Tara or myself. We'll give you a call, and then we'll go from there, okay?
Okay, gotcha. So I just immediately stop all the meds like now?
Yes, ma'am.
Okay.
Okay?
All right, and then I'll hear from you tomorrow.
You got it. Yes, ma'am.
Okay, thank you.
Yes, ma'am, Jacqueline.
All right, bye-bye. Obviously, I'm upset about the news, but there really isn't a but. I think it's just really hard for me because I was really hoping to be pregnant before I turned 30 next week, which like obviously so many things could have happened anyway. Even if I was pregnant, there's still so many things that can go wrong, so it's not like I would have had a live birth, but still it just feels like nothing ever works out. And it's so hard to like to be positive like everyone wants you to be, but then like I feel like the more positive you are, then the harder it is when you like get the bad news about stuff. So it's like I literally had just, you know, so much set up, and I was like, yeah, my baby shower is gonna be in September and the due date's gonna be January 21st, and I'm like, by the time I go back to work in the fall, like I'm gonna have a bump, and just kind of like planning out everything in my head and just like saying it and like acting as if the first try was going to work. But then it's like, how does that even help me? Like everyone always wants me to be positive, and everyone always wants me to be patient, and everyone wants me to like keep my hopes up and stuff, but it's like they're not the ones that have to go through the hard part then. I guess I'm glad that like that is just done with, and now I can move on to the next transfer, because I've seen some people where their levels might have gone up, but then they just go down a week or so later, and it's just like an extended period of time that they had to go through that. So I guess I'm glad that I didn't have to do that, and that I know now that it's done, it's over with, transfer number 1 was a fail. Or I guess part of a fail. I guess it's good that like it did implant and I was pregnant there for a little bit. I'm curious to see what they're gonna say tomorrow when they call me. If they're gonna make me go through more testing or if they're gonna let me just go and do the next transfer. I think preparing for that though is gonna take like 6 weeks again, probably at the least amount. I don't know. It just really sucks. Hello.
Hey Jacqueline, it's Sarah with Virginia Fertility. How are you?
Good, how are you?
I'm good. I wanted to call you because we had our IVF meeting today.
Okay.
And the consensus of the group of the physicians would be that their recommendation would be to repeat this same program cycle again.
Okay.
You know, specifically because you guys did not do genetic testing on the embryos, which is fine. You're young, you know, it's not something we would recommend. But, you know, most of the time patients don't get pregnant or they end up with what, like for you, a chemical pregnancy is because there's some kind of chromosome abnormality within the embryo itself.
Okay.
And so our recommendation would definitely be to do the same protocol. So for you, it would just be calling once you got your next period just to restart the process.
Okay. So is that...
So it's not like you don't have to skip a month. If you want to skip, you can. But, you know, from when you stopped your hormones, you should get bleeding within a week to 2 weeks. And if you guys want to start again out of that period, you are certainly able to do so.
Okay, yeah, that was my question. Like, when I do start bleeding, that is considered then my period, and then I can start from that. Okay, yeah,
Absolutely.
I definitely do want to repeat it right away. I was actually wondering what you guys would say or not. I didn't know if there was going to be like extra testing or not, but I'm actually glad that you guys want to repeat it.
Yeah, we would just repeat it and just go with the next cycle.
Okay, so does that mean that I would be repeating it with the birth control again, or do I just okay, so it would be like...
Yeah, we would start from the birth control part, yeah.
Okay, so then I probably wouldn't be transferring until like July, I guess, because that was like...
Probably late June, yeah, probably early July, honestly, yeah.
Okay, yeah, that sounds good then.
Yeah. Okay.
Okay, so I just call on...
Just give us a call on day 1 and we'll go from there.
Perfect, okay, thank you.
Okay, you're welcome.
Awesome, thanks.
Bye-bye.